The number one reason that people get disability is because of back pain. So today, I'm going to give you some tips on how to treat back pain. And no, it's not going to involve surgery or injections. It's going to involve 3 things that you can do right now. The American College of Physicians has released a guideline on how to treat non-radicular low back pain. That's low back pain without nerve involvement. And it's important because low back pain is one of the leading causes of disability worldwide. And this guideline is going to help inform patients and clinicians on the best way to treat acute and chronic low back pain. I recently came across this really well done article from the American College of Physicians. I'll put a link in the description below. They actually cited 8 studies with over 2,700 patients to come up with these guidelines. So what did they come up with? The first thing is for acute pain, which is less than 12 weeks. They recommend an anti-inflammatory medication like ibuprofen or naproxen. They also recommend a muscle relaxer like cyclobenzaprine or methocarbamol. And finally, they recommend a course of physical therapy. For chronic back pain, which is more than 12 weeks duration, they recommend either a short course of physical therapy or a short course of opioid pain medication with a tapering dose. They also recommend against routine use of imaging like an MRI unless there are red flags, meaning if there's any suspicion of cancer or if the person has lost a significant amount of weight, if they have new onset of urinary or bowel incontinence, if they have a new onset of sexual dysfunction, or if they have red flags in their history or their physical exam. Finally, they recommend against routine use of epidural steroid injections, but they do recommend it in certain circumstances for back pain that's not responding to either physical therapy or oral anti-inflammatory medications. This guideline applies to people who have non-radicular low back pain, meaning low back pain without nerve involvement. If you have back pain that's shooting down your leg, or if you have numbness or weakness in your leg, then you may have a herniated disc or another problem that's causing nerve compression. And those conditions are typically treated a little bit differently. If you enjoyed this, please comment below. Let me know what other questions you have. I'll make videos on them. And please subscribe.